Welcome to the other side of Lucy Letby. In episode 63, we're going to take another detour and have a look at the ramblings of a typical Lucy Letby as innocent skeptic. And that would be the journalist Christopher Snowdon. Now, I haven't got a clue who Christopher Snowdon is, no more than he has a clue who I am. He writes for The Telegraph, apparently, and a journal called Spike, and he has blocked me on Twitter. I have a lot of people on Twitter muted on my handle at reason over fear, and the only reason I mute them is because they disrupt proper conversation and exchange of ideas, and they're essentially just trolls who don't contribute anything original to any discussion that I'm having on Twitter. But I haven't ever blocked anyone. And really, why should you block anyone when you can mute them? But Mr. Snowdon has decided to block me. I have no idea why. I think he doesn't like what I say, and I don't think he can handle what I say. So he blocks it and feeds his opinions to people who obviously don't. And that seems to me to be his modus operandi. Why block people? I presume I'm not the only one who can critically think just because you don't like what they're saying. Anyway, Mr. Snowdon, who is also apparently an economist, which a former Prime Minister of the Republic of Ireland referred to as the dismal science. And in fact, it's so dismal that there are actually branches of economic science that completely disagree with each other. And so, as far as I'm concerned, economics is more like a religion than science. I remember the late Queen Elizabeth II asking all of the professors at the London School of Economics why, if they were all so brilliant at what they did, could they not predict the 2008 crash? And God rest her, I don't believe she ever got an answer. Nor did any of the rest of us. Anyway, we're going to have a look at Christopher's opinion about the Professor Hewley press conference, where he outlined the findings of 14 well-qualified medical scientists as to the actual causes of death in the babies who died in the Countess of Chester Hospital and who were subsequently linked to Lucy Letby. Now, we have to remind Mr. Snowdon that there were actually 18 babies who died, and we don't know too much about them. But Letby was convicted of murdering 7 of them and attempting to murder 7 others. So not only did we have 18 deaths in a shit-infested neonatal unit who did 2 ward rounds a week, we had countless collapses and near-death experiences as well. And God knows what the ultimate morbidity from these collapses was. And that would be children with chronic lung disease, cerebral palsy, and all the other terrible things that can come about when you don't care properly for very delicate newborn babies, which Mr. Snowdon is totally ignorant about. So let's go through his article on Spike and correct some of the things that he doesn't understand. The article starts out, what a turnaround. At the start of last week, those who believe Lucy Letby is innocent had no truck with boffins and eggheads from the medical establishment. Now, straight away, opening sentence, how illogical is that? Because the very people who worked to produce this report are boffins and eggheads. 14 of them. So I think that's a bit of a dickhead start rather than an egghead start. If Mr. Snowdon knew anything about the group of people who are trying to help Lucy Letby, the NHS, and all the rest of the nurses caught up in this disaster, he would know that most of them are scientists. But he carries on that the Letby skeptics prefer to do their own research. Well, what's wrong with that? It's perfectly easy to do your own research, and it's a hell of a lot more than the prosecution expert witnesses did before giving their evidence. And I know that because had they done some proper research, they wouldn't have given the evidence that they gave. The article goes on in their telling that his former lawyer, Ben Myers KC, was useless. No, he was not useless. He covered all the bases and actually did a very good job. But no barrister in the world can do a good job if the expert witnesses that he's cross-examining to create facts tell him lies. And we have covered multiple lies in my podcasts. Doctors only covered their own backs, says Christopher, which again isn't true, because what's happening to those doctors now proves that they didn't backs. Doctors thought they were covering their own backs, but they weren't. None of the expert witnesses who testified in either of her trials knew what they were talking about. Again, completely wrong, Christopher. They knew exactly what they were talking about. The opinion of the prosecution's lead expert witness was worthless because he was retired. No, that's not the case. It was worthless because a senior appellate court judge who had run into Darry Evans in the past warned Justice Lucy Letby, trial judge, that Evans and his reports should be at the very least subject to very sceptical scrutiny or ruled inadmissible. And again, for all the reasons we've talked about in my podcast, that turned out to be prophetically correct. The Letbyists made an exception for the occasional statistician if they got on board the Lucy Mobile. Well, there is no Lucy Mobile. No one was invited onto the Lucy Mobile, and the only statisticians who have spoken out about the Lucy Letby trial are statisticians who have pointed out just how fake the statistics were that were presented to the jury. There are plenty of other statisticians in the country and the world, but so far, one of them have chosen to contradict the findings of the Letbyist statisticians, because it's not about Lucy Letby, but not entirely. It's about watching science dismantled in front of your face to the detriment of ordinary people. And whereas Christopher Snowdon might be happy with this, I am not, and many other people like me, including statisticians. But as a rule, Snowdon carries on, if you ask them where to find the truth about her case, they would recommend maverick podcasts, obscure websites, and anonymous axe feeds. Well, that's not true either, is it? Most of us who are actively involved to free Lucy Letby, and just as important, to tell the parents what actually happened to their children, have access to all of the data. And in fact, even more data from the Thirlwell inquiry that wasn't available to the jury at the time. And also, we have examined the RCPCH report into this hell, the hospital, which the jury didn't see in this trial either. And my axe feed, Peter Allison's axe feed, and many others are not anonymous, which makes Christopher Snowdon ill-informed, to say the least, prejudiced and snobby, to say the worst. Unless you write for the Telegraph or Spike, your opinion isn't important. The logical appeal to authority, which he's actually complaining about in this article. So far, we've had the first paragraph, and it's full of factual mistakes. And he carries on, it only took one press conference to turn these fearless free thinkers into bootlicking credentialists. The panel had been assembled by Letby's new lawyer, Mark MacDonald, and the star turn was Professor Hugh Lee, a retired neonatologist and health economist who discussed 7 of the 15 counts of murder and attempted murder of which Letby was convicted, and explained that they were not murders or attempted murders at all. So let's correct that gross mistake as well. And it's very clear that Snowdon didn't listen to the press conference, because if he had, he wouldn't be saying this. Or maybe he would. I don't know, because I don't know Christopher Snowdon, and I don't care to. The international panel was formed by Professor Hugh Lee, not Mark MacDonald. Professor Hugh Lee organised the press conference, not Mark MacDonald. This is actually the second press conference, not the first, and the work that went into the press conference continues into its fourth one. He goes on, he really does, doesn't he? Lee is an eminent neonatologist, eminent in emphasis. That would be Snowdon's emphasis, because no one in the Letby camp calls him eminent. And indeed, most of us are not great admirers of the work he did in 1989 to produce the paper which Dowie Evans used, because we don't think it's a particularly good paper, for many reasons that are beyond the scope of Christopher Snowdon's comprehension. And Lee was summarising the findings of a team of experts, mostly other neonatologists, who had been working in pairs pro bono on each of the 7 charges at Lee's request. No, they weren't working in pairs, they were working in triplets. 2 independent, blind reviews, reviewed again by Professor Lee, and where there was academic deadlock, reviewed by Ferguson. These medics were also described as eminent, not an emphasis this time, thereby distinguishing them from all those clueless doctors and professors who think that Letby is guilty. Well, so far we haven't heard from any other professor or doctor who thinks that Letby is guilty, because they would be, quite frankly, too embarrassed to own up to the fact that they agreed with Dowie Evans. Lee's intervention is of particular interest since one of his studies helped convict the nurse. And if you read the Court of Appeal judgment, that's not actually true either. A paper he co-authored in 1989 looked at the rare condition of air embolism in you. No, it didn't. So even though Snowdon has given us a link to the paper, he obviously hasn't looked at the paper, which the experts in it didn't do either, because he doesn't talk about air embolism in his paper, the 1989 paper. He talks about pulmonary air embolism, which is an entirely different disorder and is the equivalent of turning up to give a lecture on gastric cancer, but talking about brain cancer instead. Christopher Snowdon has got everything wrong so far in this article. I wonder will he consider taking it down. Dr. Ravi Jairam, the consultant paediatrician who worked with Letby, has said that he remembers the physical chill that went down my spine when he read it, because it appeared to describe the same unusual blotches that he and his colleagues had seen on some of the babies when they collapsed. Lee disagrees. He says that the unusual rashes observed by Letby's colleagues are different to the discolorations discussed in his 1989 paper. He argued that his original paper did not make a distinction between venous and arterial air emboli, which is absolutely correct, because in 1989, the evidence base for air emboli, which Dr. Lee and Tanswell tried to clarify at the time, hadn't yet classified the distinct clinical difference between venous air embolism, pulmonary vascular air embolism, arterial air embolism, or paradoxical air embolism, and indeed lymphatic air embolism, all distinct disorders. Letby is accused of killing the babies by injecting air into their veins, causing venous air embolism, which Lee, in a later study, claims does not present with skin discoloration. No, Lee did not make that claim at all. He made the claim in the paper that of all the cases, the 117 cases reported in the literature and included in the new Lee and Tanswell review, now classified into the different types of air emboli, no one had previously reported any skin discoloration associated with venous air embolism, making the observations of the doctors in the Countess of Chester Hospital unique. But the difference between the cases that Professor Lee cites in his paper and the cases in the Countess of Chester Hospital is that the observations in Professor Lee's paper were reported by the observing physicians, which is not the case in the Countess of Chester Hospital. The clinical records and the report to the coroner don't contain any references to the skin discoloration that Letby was accused of causing. The article carries on. He says that his research as Professor Lee should not have been used against Letby. When Letby sought leave to appeal last year, Lee testified on behalf of the defendant. Some of the babies, according to Snowdon, did present with skin discoloration. Now, again, that's not correct. Skin discoloration was part of the presentation. The presentation was collapse. The shift leader on duty when baby A collapsed described him as being very white, with a sort of purple blotches and very cyanotic. So this is a really strange description of any discoloration because it contradicts itself. The baby is described as very white. The medical term for that is pallor, but it's simultaneously described as very cyanotic. So we have a white and a blue baby at the same time with sort of purpley blotches. The medical term for purple is libido, and we don't use the term blotch. If it's less than 1 centimetre and it's flat, it's called a macule. More than 1 centimetre and flat, it's called a patch. We don't know which of these the nurse saw, but it doesn't matter because pallor, cyanosis, and libido can all appear at the same time in any shock condition, but they will eventually go to pallor if the baby dies. And then he carries on, typically, whatever these blotches were, well, Christopher, they weren't blotches, they were patches. Many of the doctors and nurses who saw them said that they had never seen anything like them before. And it's very odd that this would be one of the strongest arguments that people have to prove Letby's guilt. The nurse has just described the concurrent presence of pallor, cyanosis, and libido. And all of the descriptions in the evidence are simply variations of that. Pallor, cyanosis, and libido, big deal. Just because you haven't seen them before doesn't mean anything in relation to their appropriateness as an observation in these circumstances. Yes, they are totally appropriate observations in any baby who has shock for any reason. Therefore, they are non-specific findings, and it's a waste of time and bad medicine to concentrate on them, which Dr. J. Ram actually says himself in his own evidence. He claims he didn't write them down because he was too busy trying to save the baby's life. That's how much importance he gave to them, and that's how much importance they deserve. The article carries on, but let us take Lee's word for it, that blotches must have been caused by something else other than venous air embolism. He is, after all, eminent. The bottom line is that his protestations cut no ice with the judges at the Court of Appeal, who in July said that it had never been claimed that the presence of such rashes proved air embolism, nor did the absence of them disprove it. There was, they said, enough evidence of air embolism without his study, and the jury could have convicted her if it had never been mentioned. We can never be certain that the latter is true, but that's how it went. Leave to appeal was rejected. And frankly, I'm sick hearing this argument. The Court of Appeal judges reached the erroneous conclusion that making any diagnosis in medical practice is just a matter of stringing together a few signs and symptoms. Having some experts say that that proves the presence of a disease, and Bob's your uncle, you've got a diagnosis. Now imagine that were the case, Mr. Snowdon. Why would there be any waiting list in the NHS at all? We could diagnose and treat everybody on the same day they walked in. But there are waiting lists because this is an infantile way to assume in your ignorance that medicine actually works this way in the 21st century. And what were the clinical or pathological signs, symptoms and findings presented to the court that were sufficient to confirm the presence of an embolism? Not to any standard less than you, Mr. Snowdon, would expect that any cancer that you might present with would have a detailed medical description as to its origin, differentiation, classification, and staging, all of which are commonplace in medicine and are necessary in order to treat the patient. The evidence for embolism in the Letby case, according to Dowie Evans, were X-ray findings and histology findings. The X-ray findings from Professor Arthurs and the pathology findings from Dr. Marnarides. Except that doesn't cut the mustard, and the Court of Appeal judges got that wrong too. Professor Arthurs made it very clear that we can only diagnose venous embolism from an X-ray if we find large volumes of gas in the heart and great vessels at the exact moment of collapse, which, strangely enough, it also says in Professor Lee's first paper. And the reason why we have to say that is because the air has many routes into the body, including mechanical ventilation, venous central lines, and cardiopulmonary resuscitation. Now, since air is air and it isn't visible on an X-ray from any other type of gas, to make that diagnosis, venous embolism, we have to not only find the air on an X-ray in the heart and the great vessels, but we also have to make sure that it's not coming from a different source, the ventilator or the central venous lines. And sadly, X-rays or histology can't tell us that. So, in effect, we don't have any evidence for the presence of emboli in these babies, but we do have a lot of evidence of other pathological findings. So Snowdon carries on. By this time, if not earlier, Lee had become convinced that not only was his study misused, but also that Letby is an innocent woman. And so he started emailing his contacts around the world to see if they would help him out. As he told the Sunday Times last week, after Letby's appeal failed, her legal team told him that for her to have any chance of being released, you have literally got to find a different person or thing that caused the death. This is where all the eminent professors come in. Their summary report, published on Monday, gives very brief alternative explanations for 7 of the murders and attempted murders. Innocent explanations for the other deaths and collapses are to be published in the near future and will be sent to the Criminal Cases Review Commission, which is the only realistic path to the Court of Appeal for Letby. There is no doubt, he says, that Lee's experts are nearly all at the top of their profession or somewhere near it, and their concerns should be taken seriously. It is less clear whether they had access to all the information available to the experts who were called in the original trials, and there is a strong indication that they had little idea of what was said in those trials. No, that's not correct. They have the transcripts. So they probably know more than you do, Christopher, about what was said in those trials. But the experts needn't bother with every word that was said in those trials. They only need to bother with the lies that were told during those trials. Let me give you just one example. In the case of baby A, Dr. Bowen told the jury that umbilical venous catheters don't move for 2 weeks after they're put in, when everyone knows that they can migrate or move within hours of going in. And it's really important that the jury knew that, because, as we'll see in a minute, it's very relevant. Letby's defenders often portray the prosecution case as being a one-man crusade by the retired paediatrician Dr. Dowie Evans, who has become something of a hate figure on the loony Letbyist fringe. No, that's not what the Lucy Letbyists say. We are highly critical of practically everyone involved in the prosecution of Lucy Letby. In fact, his analysis was peer-reviewed and approved by the late Dr. Martin Ward Platt. Well, some of his evidence was reviewed by the late Dr. Martin Ward Platt, and that would be the same Dr. Martin Ward Platt who reviewed Sir Roy Meadows' evidence in the miscarriage of justice conviction of Angela Canning, which conviction Dowie Evans is very critical of. And Mr. Snowdon goes on to say that Martin Ward Platt can be fairly described as an eminent neonatologist and was tested in court by neonatologist Dr. Sandy Bohan, who just told you a porky about umbilical venous lines, forensic pathologist Dr. Andreas Marnarides, who claims to be able to see air in a histology slide, something which is impossible for any human to do. Yes, he can perceive that he sees gas on a slide, but how does he know it's air? He doesn't. Hematologist Professor Sally Kinsey, who actually told the jury that venous blood is blue, which is a first-year medical student mistake, because it's never blue. And I'm blue in the face telling people that. Professor Owen Arthurs, who's already told us the only way you can use an X-ray to diagnose our embolism, and that you cannot use post-mortem X-rays to diagnose our emboli, because they wouldn't meet any kind of international standard for diagnoses. But I guess the jury missed that bit. The appeal court judges certainly missed it. Quite frankly, X-rays post-mortem are a joke. And Professor Arthurs has written many papers on the use of CT scans post-mortem, MRI. And the only recommendation he makes for the use of an X-ray is when you're looking for fractures or to date injuries or indeed the gestation of stillborn babies or newborn babies. Beyond that, they have no use whatsoever. Professor Hinmarsh, pediatric surgeon Dr. Simon Kenny, and pediatric neuroradiologist Professor Stavros Stileros, as well as other medical experts and numerous doctors at the Countess of Chester Hospital. The purpose of all this name-dropping is to show that there are eminent and distinguished medical experts in both camps. Yes, and that is totally irrelevant. Who is the humble normie to believe? The temptation is to say that the experts cannot make up their minds and that there is therefore reasonable doubt. Perhaps if Letby had elected to call an expert medical witness for the defence, the trial would have descended into a shouting match of, oh yes it is, oh no it isn't, and the jury would have acquitted her in a fog of confusion. We will never know, but it is important to remember that it was Letby's call to make. She decided to call a plumber instead of any medical experts. And on that point, Mr. Snowdon, did the plumber put any facts into evidence? Well, apart from a few dates and locations of disastrous sewage leakage on the ward, he didn't put any other evidence into fact because he only spoke to the advocates. For some odd reason, the eminent experts that you talk about in the Letby trial didn't attach any significance to sewage on the ward, which, as it turns out, as part of the fact package given by Professor Shuley, was a little remiss of them. And then he really crowns his ignorance now by saying, and yet there are reasons to have more faith in the prosecution's witnesses than in Lee's assembled team of eminent Letbyists. It is much easier to present a hypothesis at a press conference in a hotel in front of Peter Hitchens and Nadine Dorris than it is to be cross-examined in a court of law. I would not be surprised if Dowie Evans or other experts rebut some of the claims made in the Lee reports in due course, or even a layperson can spot some significant flaws. Well, it hasn't happened yet. Dowie is standing by what he said, of course, but so far he's failed to address any of the major problems raised by Professor Lee and his team. This is the second press conference organised by Letby's lawyer Mark MacDonald in the past 2 months. At the last one, we heard from Professor Richard Taylor, well, he's not a professor, a neonatologist who was inevitably described as eminent and who accused the doctor of accidentally killing baby O with an inappropriate injection. No, that's not what he said at all. He never mentioned an injection. In fact, he talked about the opposite, a cannula used to withdraw something from the body, not inject something into the body. I guess you didn't listen to that one either, Christopher. He did not name the doctor, but he was easy enough to identify. Well, that's because he actually wrote the notes up of what he did with the cannula. I think even you could identify that. Taylor said he would not be able to sleep at night if he was in the doctor's shoes, knowing they had sent the young woman to jail for life for a medical blunder of his own doing. To call sticking a needle into the right-hand side of a baby with no imaging a blunder serves only to further highlight your ignorance. It was a powerful and emotive speech. No, it was the answer to a question. But there was no sign of Taylor at this week's press conference, and neither of the neonatologists who prepared the report for him were mentioned. The explanation for baby O's death in Lee's report is no longer the medical accident Taylor described it as in his press conference, and that's simply untrue. We are now told that it was the result of liver damage caused by traumatic delivery. Yet, baby O was a triplet whose mother gave birth via a planned caesarean section, and there is no evidence of any injury sustained during the course of it. Where did this idea come from? And what happened to the hypothesis that MacDonald's other expert was so insistent upon a few weeks ago? Well, let me explain it to you, Christopher. The caesarean section was not planned to take place at the Countess of Chester Hospital. If you took the time to read the mother's statement from the court record, this is what she said. She was informed the triplets were unlikely to stay at the Countess of Chester Hospital neonatal unit. There will not be space for 3 nursery beds, and they may have to be treated at Birmingham. But the babies were born at the Countess of Chester Hospital 1 minute apart. The father told us at the Thirlwell inquiry that the theatre was a dingy, filthy little room, and that the amniotic fluid hit the back of the wall when the incision was made for the section. As a consequence, the babies were born very rapidly. And it's at this point that Mr. Snowdon obviously didn't do any research before he wrote this, because this is what Dr. Lee said. Baby 15, that's baby O, collapsed because the subcapsular hematoma ruptured, causing acute major hemorrhage into the peritoneal cavity, sufficient to cause a near halving of the hemoglobin level. Subcapsular liver hematoma is the result of traction or shear forces applied to the thin, fragile liver capsule applied through the hepatic ligaments. In baby 15, this was highly likely the result of the extremely rapid delivery, which is a well-recognized cause of birth injury. Bleeding into the subcapsular hematoma is characteristically initially slow because it is contained by the pressure of the enveloping liver capsule. In these early stages, the clinical signs are insidious and difficult to recognize. The slow deterioration is then characteristically followed by acute collapse when the capsule ruptures, releasing free blood into the peritoneal cavity. The significance of the rising heart rate and falling pH before the terminal collapse was not recognized. The blind abdominal insertion of a needle during the resuscitation may have penetrated the right lobe of the liver, causing further injury noted by the pathologist as parenchymal hematoma and laceration. Blunt, direct trauma to the right abdomen or chest is implausible because it is very difficult to generate the kind of force required to produce the observed injuries in a liver protected by the lower chest wall. The gaseous distension of the intestinal tract was likely due to air swallowing, aerophagia, and insufflation during non-invasive respiratory support. The suggestion of injection of air into the circulation is conjecture. So you can see, Mr. Snowdon, that Dr. Taylor's injury hasn't gone away. The expert panel included in their report, but we're talking about 2 injuries here, not 1. And we can be sure of that because of the post-mortem findings. Again, back to our classifications. Subcapsular hematoma is a different disorder than parenchymal hematoma. Therefore, they both come about by different means. And so the expert panel, in their eminence and the 400 years of practical experience that they have, brought yet another problem to the table that wasn't addressed at trial. The well-known occurrence of subcapsular hematomas due to birth injury. And the reason that we have these discrepancies is because of the post-mortem findings. The post-mortem findings were that there was a combination of clotted and unclotted blood in the peritoneal cavity. The clotted blood would have come from the subcapsular hematomas. The unclotted blood would have come from the penetrating injury because it had to happen at the moment of death. So now we have an even clearer picture of what likely happened to these babies, something which their parents need to be told, not that you seem to care about that. Taylor also insisted in December that the insulin test that showed deliberate poisoning of baby F was wrong. The readings were simply too high to be believable, he said. This week, however, these experts told us that the insulin test was correct, but there was nothing abnormal about the readings. The new report claims that baby F's C-peptide was not low for preterm infants, and the insulin C-peptide IC ratio was within the expected range. This is a baffling interpretation of the facts. It might be baffling to you, Mr. Snowdon, but you need to pay more attention at the back. Dr. Taylor said that the glucose reading of 999 millimoles per litre was an impossibly high reading, which it is. He also said that the insulin level was ridiculously high, which it is, and that the C-peptide reading was within the normal range. But then, had you paid more attention to the presentation, you would see why it's ridiculously high, the insulin reading. This is what the panel said. The hypoglycemia started with sepsis and was prolonged because the IV infiltrated for several hours. That is, a tissue. When hypoglycemia persists despite 10% dextrose infusion, a higher glucose infusion should have been given earlier. Standard practice. Repeat boluses of 10% dextrose worsen hypoglycemia because they can cause surges of blood sugar, which triggers surges of insulin secretion, resulting in a yo-yo pattern of sharp rises and falls in both sugar and insulin. When the dextrose infusion was stopped from 10 to 12, the blood sugar did not rise from 1.3 to 2.4 as alleged because the blood sugar was 1.4 at 11:46. The 2.4 level was measured after 12, when the IV had been restarted. The blood sugar rose after 1900 hours, not because the infusion bag was changed, but because the dextrose was increased to 15%. Chase and Shannon, see Annex, reported that preterm infants have different insulin and C-peptide normative standards than adults. You see, Mr. Snowdon, we can't use these ratios with preterm babies because they're preterm babies. Exogenous insulin is unlikely to be the cause of hypoglycemia because the C-peptide was not low enough. Yes, Mr. Snowdon, when we look at cases of accidental insulin administration to preterm babies, we rarely find any C-peptide. But here, the C-peptide was in the 20 to 45th centile. In other words, normal. Potassium levels were also normal. In fact, they actually rose between samples when insulin, particularly this amount of insulin alleged, would cause potassium to fall by an independent pathway not related to glucose. And then the kicker, insulin autoimmune antibodies, IALs, which are common in preterm infants, bind to insulin and increase measured insulin levels. And the immunoassay test is unreliable because interference factors like sepsis and antibiotics can give false positive insulin readings. Therefore, all that Professor Chase and Helen Shannon did was to add more detail to what Richard Taylor said. It is not the fact that there was 4,650 nanomoles per litre of insulin actually present in the baby, which would have forced both the potassium and the C-peptide down, but which didn't. But the measured insulin was a combination of endogenous insulin and interference from autoimmune antibodies and other factors, which is well known in medicine. And I would question whether this particular immunoassay is even validated for use in preterm infants because it's going to be so unreliable. And as we found out at the Thirlwell inquiry, the proper test for the confirmation of exogenous insulin poisoning, liquid gas chromatography, isn't available in Britain. The nearest machine is Germany. I do hope you're keeping up, Christopher. And he keeps on digging a hole for himself. Of course he does. Pay attention at the back now. You don't need to take Christopher's word for it. This is what he says. And why should you? Absolutely. Because Dr. Anna Milan, principal clinical scientist at the lab where the test was done, told the Thirlwell inquiry, which is examining the circumstance around Letby's crimes, that BBF's ratio of C-peptide to insulin, which should have been 5 to 1 and 10 to 1 in adults, was recorded as 0 to 0 because the C-peptide was at an undetectable level. On what planet is that within expected range? That would be planet Earth, Mr. Snowdon, for the reasons I've just given you. We're not talking about adults here. We're in a different world. And undetectable levels wasn't the reading given during the trial. The reading given during the trial for BBF C-peptide was 254 picomoles per litre, which is well within the capabilities of the assay and is in the 20th to 45th centile of the measurement you will find in all preterm babies. Not adults, but preterm babies. Why would Dr. Anna Milan want to tell the Thirlwell inquiry one thing and Professor Hinmarsh want to tell the trial a different thing? On what planet does that happen in a murder trial? Planet Snowdon. And things just keep getting worse for Christopher. He really should stick to the dismal science of economics. He says that Jeff Chase said that BBF did not collapse as a result of being given insulin, but developed hypoglycemia because he had sepsis. The trouble is that, as the court heard during the trial, his blood gas reading did not indicate sepsis. Blood gas readings don't indicate sepsis. Christopher, they indicate blood gas readings. In order to find sepsis, you have to culture the blood. And in order to culture the blood, you need to have enough of it. And if you don't have enough of it, you won't find sepsis, even if it's there, from low colony-forming unit infections, which are the most common type in preterm neonates. and therefore, sadly, proof of sepsis is pretty rare. And we carry on. Similarly, Lee's report strongly implies that BBA had antiphospholipid syndrome. No, it doesn't, and explicitly states that he died of a blood clot. Yet, the paediatric hematologist, Professor Sally Kinsey, who says that venous blood is blue, told the court that BBA didn't have the disease and that his blood count results were normal. But sadly, Christopher, count isn't really relevant to the argument that Dr. Lee was making. You see, antiphospholipid syndrome is an autoimmune disease which affects the mother, not the baby. Although there are cases of de novo ASP in preterm babies, but in order to find them, you don't look at the blood count. You have to look for specific antibodies, which the Countess at Chester Hospital didn't do. In fact, about 30% of babies born to mothers with antiphospholipid syndrome will have antibodies similar to those in the mother in their blood. But as I say, no one looks for them, and the blood count won't tell you if they're there or not. And Snowdon carries on. Much of the evidence that convicted Letby came out during the trial and would not necessarily be found in the medical records. I have no idea what this means. Where else would you find them? For example, Lee's report says that BBD, who had pneumonia, continued to deteriorate after admission, whereas the neonatologist who gave evidence in court said she was improving and getting better. This is perhaps the kind of thing that eminent medics can have an honest disagreement about. But the mother of BBD told the Thirlwell Inquiry the same thing, and when Letby texted another nurse to tell her that the child had died, she received the reply, "What? But she was improving." Are we supposed to discount the testimony of people who were there at the time? Yes, if it's inaccurate. Let's remember, what were the post-mortem findings of BBD? Pneumonia with acute lung injury. What is acute lung injury? The deadly inflammatory response to pneumonia. How many babies will begin recovering from pneumonia within 36 hours of birth when the pneumonia occurred in utero? That would be none of them. 36 hours is barely enough time to reach an effective level of antibiotic in the blood. Did the nurse who messaged Letby know about the prolonged coagulation times? Because the jury didn't. Did the nurse who thought that BBD was improving know what effect prolonged metabolic acidosis has on the heart? And did she know that the baby had disseminated intravascular coagulation? Because the family don't know that, and the jury didn't know that. And if that's not new evidence, I don't know what is. And Snowdon finishes off his article. Eminent and distinguished medics, though they may be, much of what they are saying is legally hopeless, if not actually hopeless. In their attempt to exonerate Letby for the attempted murder of BBK, they claim that this tiny girl desactivated due to the incompetence of another easily identifiable doctor who supposedly did not understand the basics of resuscitation, early mechanical ventilation, and how equipment that were commonly used in the unit worked. And it's odd that Snowdon would make this comment about Dr. Jairam, because in evidence, Dr. Jairam admitted to these things himself. Oxygen saturations fell to 40% in BBK. The tube was removed. BBK was bagged via face mask, and the sats recovered quickly. Ergo, the tube was blocked. We don't need to complicate it any more than that. And in relation to catching Letby red-handed, he said there was absolutely no evidence that we could prove anything. The court is shown slight data for Joanne Williams, who left the neonatal unit at 3:47. But we now know that she came back to the neonatal unit at 3:47. Jairam said, why would he ask Joanne Williams anything? Because she wasn't in the room when it happened. But as it turns out, she was in the room when it happened. And as regards the intubation and the 94% air leak, he says the leak is a measured value. So why do we measure it? And it's significant if the baby is struggling to be ventilated, which is precisely the situation that baby K was in. But if the baby is being ventilated, which it wasn't, then it is just noted. So Dr. Jairam thinks that it's okay to simply note a 94% leak. It's very easy to take a swipe at that. In fact, you don't even need to be an eminent physician to take a swipe at that. Snowdon carries on. This is one of several swipes at the doctors who blew the whistle on Letby that we have seen in recent months. Except Sarah Napton published comments from the whistleblowers charity who said that these so-called whistleblowers at the Countess of Chester Hospital had no characteristics similar to the 12,000 or 13,000 other cases that they had dealt with since 2003. But it completely misses the point, says Snowdon. She was not convicted of the attempted murder because of medical evidence, but because of the eyewitness testimony of Dr. Jairam, who saw her standing over the desaturated baby in question with the endotracheal tube dislodged and the alarm muted, doing nothing. But we have to remember that the first jury didn't believe Dr. Jairam because she wasn't found guilty by then. But when she was referred to a mass murder during the second trial, of course the jury found her guilty. Lee's report claims that there is no evidence to support dislodgement of the endotracheal tube. But there is from Dr. Jairam, and the jury believed him. The first jury didn't believe him. And there is no evidence to support the dislodgement of the endotracheal tube, but there is evidence that the 2mm tube put into the baby came out. And it came out very easily because there was a 94% air leak around it, which would have effectively rocketed it out. And we know it came out because it was a 2mm tube with an air leak because they replaced it with a 2.5mm tube, which they should have used the first time round, but didn't because they didn't have enough knowledge to anticipate that a 2mm tube was going to come out. The Court of Appeal will not tolerate appellants repeating arguments that have already been made and repackaging evidence that has already been presented. The case of BBK is done and dusted, and Lee's eminent neonatologists are bringing nothing new to the table. Yes, they are. The 94% air leak was dismissed by Jairam as something that you just had to take a note of when it was actually the cause of the dislodgement. Likewise, Lee's team's explanation for the death of BBD is pneumonia. So too was the pathologist, and acute lung injury, the inflammation that goes with pneumonia. She was born with pneumonia, and pneumonia was listed on the death certificate. The defence maintained that she died of pneumonia, and the prosecution succeeded in showing that she didn't, which is the equivalent of persuading people that the Titanic didn't sink. There is no doubt that you could persuade people of that, perhaps even people like Mr. Snowdon. How do I know? I'm only an armchair barrister, but it seems to me that this argument has no more road to run with the Court of Appeal, which, as MacDonald himself acknowledges, has a low tolerance for expert shopping. That is, scouring the world for experts who have a different opinion. And would that include the expert who gave evidence at the trial, the principal expert, Dr. Evans, who has also since changed his mind and gone shopping for a different diagnosis? Would the appeal court judges have a higher tolerance for that? Unless they are keeping an enormous amount of powder dry, these team of devil's advocates are wasting their time on a lost cause. The press conferences are nothing more than publicity stunts designed to sway public opinion in Letby's favour, in the hope that the CCRC buckles under the pressure. In the wake of the mishandling of the Andrew Malcolmson case, this strategy might just work. But if it does, I expect the Court of Appeal to throw it out and Letby to stay in prison. Letby's supporters have described her case as the biggest miscarriage in British history. If she were innocent, it certainly would be. It would also be the most bizarre. Imagine for a moment that Shuley is right, and none of the deaths and collapses were due to foul play, and many of them were due to the incompetence of doctors. How did we get from there to here? How did an innocent nurse end up in prison? The chain of events required for such an unjust and unsettling outcome was not explicitly discussed at the press conference, but it is implicit in all the chatter about Lucy being a scapegoat for a failing NHS. It would require a group of doctors who were under no suspicion whatsoever to panic about a spike in deaths in that most people in Chester, let alone the rest of the country, were completely unaware of it. It would mean that despite a review by the Royal College of Paediatric Childhood in 2016 that did not point the finger of blame at any doctors, they nevertheless decided to feed a colleague to the wolves. And luckily for them, there was a nurse who just so happened to have been at every unexplained collapse and death in the past year or so, with these incidents following her from the day shift to the night shift, or the night shift to the day shift, whatever way, and stopping whenever she went in. But of course, we have absolutely no evidence for that at all. And in fact, we have a growing body of evidence of cherry picking of events. But in any event, diseases are not a series of events. They're a dynamic continuum. When, as in the case of BBD, you decide that you're not going to cover premature rupture of membranes with antibiotics for over 3 days, then you opt for expectant delivery, not managed delivery, and end up with an emergency cesarean section. This train of events has already put the disease process into action. The outcome started with those decisions, none of which had anything to do with Lucy Letby. And it's something that Snowdon and all the others don't understand. Just as, fortunately, this young woman who had once failed her final year student nurse placement because she lacked empathy, also had a habit of falsifying medical records, misleading colleagues, and looking strangely excited when infants died. Well, let's talk about empathy. When I finally left hospital to become a GP, I had no empathy left. In fact, my course trainer told me that his only job was to turn me back into a human being, because that's what hospital does to people. The medical records in this hospital were appalling. All colleagues mislead one another because they're humans. And how do you measure strangely excited when infants die? These doctors then raised concerns with NHS managers who didn't want to know and who actively discouraged them from looking into the spike in deaths. That is totally untrue. Dr. Breary held multiple reviews, case mortalities for each baby, and a themic review. No one stopped them doing that. No one, as I've said before, stopped them going to the Child Death Oversight Panel for the 18 deaths that happened on that. And yet, still, inexplicably, they proceeded to pursue this innocent woman until they got the police involved, even though it meant having to answer tough questions in court, making their hospital world famous for harbouring a serial killer, and ultimately resulting in a public inquiry into why they failed to stop her. In a further stroke of luck, it turned out that the nurse they used as a scapegoat, because of the unlikely coincidence of her invariable presence at every suspicious event, to the extent that she was nicknamed Nurse Death by junior doctors. And Christopher, having never worked in a hospital, doesn't realise that every hospital has their Dr. Death or Nurse Death. We call it gallows humour. Also happened to be obsessed with looking up parents of dead babies on Facebook. She looked up a handful of people on Facebook that were related to her work and looked up thousands of other people who weren't. She also stole 257 handover sheets from the hospital, which means, statistically, that her keeping of handover sheets had nothing to do with babies that she allegedly harmed, because many nurses will argue that handover sheets are personal records they keep, and they're not part of the hospital record, which she took with her whenever she moved house and kept the selection in a bedroom at her parents' house in a box marked Keep. And I wonder how many other boxes were marked Keep. She did this despite claiming that these pieces of paper meant nothing to her, and despite having a paper shredder, which she later told the police she didn't own. Well, I hope no one has a look in my attic to see all the bizarre things that I've kept over the years, which really mean nothing to me, but I can't bring myself to throw out. And he goes on. Better still, she had been writing notes saying things like, I am evil, I did this, and I killed them on purpose. But in the same note, of course, she also wrote, I didn't do anything wrong, but it's inconvenient for people to mention this. And she started imagining a life in prison long before there was any suggestion of a criminal investigation, because he was likely asked, as I would ask people, what is the worst thing they can do to you? And we do this in an effort to de-escalate anxiety. Once the criminal investigation was underway, dozens of collapses and deaths were scrutinised in great detail, and yet, in a final stroke of good fortune for the doctors, nothing pointed the finger of blame at them. The nurse went to prison and the doctors lived happily ever after, apart from all the Letbyists calling them liars and murderers. Somehow, I don't think Dr. Beery and Dr. Jairam are living happily ever after. It is a ludicrous proposition, finding a scapegoat for the failings of a hospital that was not particularly bad by NHS standards, but have been an insanely dangerous gamble for no reward. If fatal medical blunders had occurred, the safest course of action for the doctors would have been to shut up and get on with their job, which is what the NHS managers, who had no suspicion of anyone, wanted to do. But they didn't do that. They knew that they had done no wrong, and they strongly suspected the malevolent presence that hung over the neonatal ward in 2015 and 2016. Her name was Lucy Letby, and her best chance of seeing the courtroom again is when she is tried for further crimes. Christopher Snowdon is a director of lifestyle economics at the Institute of Economic Affairs. He is also co-host of Last Order's Spite Nanny State podcast. So what would it take for Christopher Snowdon to change his mind? He tries to decipher human motivation. He rolls out the same old tropes, the non-confession, confession, the statistical abomination of Letby's association with every collapse and death, the willful disregard for the gold standard method for determining cause of death, post-mortem. And as for people like me, I don't know Lucy Letby. I am never likely to know Lucy Letby. But I know Lucy Letby did not do the things that they said she did. And I know that because I practiced medicine for 40 years, and it just doesn't work the way Christopher thinks it does. The observations and the findings that were presented in evidence to the court at Letby's trial paint an entirely different picture than the conclusion drawn by the experts at that trial. And that isn't going to go away. And sticking with these non-diagnostic findings is unfair to the parents and is hellishly dangerous for any patient coming into the NHS for the first time. Our main interest is making sure that the integrity of medical diagnosis remains very high, and the restoration of dignity for the patient and to the patient has to return after its long absence. Sticking blindly to the Letby convictions is dangerous for patients. Sticking blindly to the conclusions of a single expert, Gary Evans, who not only attended the court and gave evidence, but also essentially ran the investigation, is dangerous. And while all of these facts remain in place, and the main drivers of opinion about Lucy Letby are amateurs like Christopher Snowdon, people like me are not going to go away. I didn't give my life to medicine to see it turn to dust in my last days. Christopher will see more and more revelations about the care of these babies, and so too will the families. And I feel sure that one day he will have to change his mind. And you know something? There's nothing wrong with that at all. So that's my feelings about the Christopher Snowdon article. It's nothing new. It's the same old stuff. And I hope I've helped you understand it. And we'll get back to Shuley's presentation in the next episode. And I'll see you then. Bye.